Hi, Doc. Good afternoon.
Hi, good afternoon.
Mm-mm. So, hi to everyone who's watching us today. Um, a happy New Year. We've started a new year. It's 2022, and we're so happy to have you join us today for our the first Ask Your Asian Eye Doctor session for the year. So today we're gonna have Dr. Jessica Caguioa. He's gonna be talking to us today about Ortho-K. Ano ba yung lenses na to and how can it be helpful for the people that want to correct their vision without having surgery. So to give you a little bit of background about Dr. Jess, si Dr. Jess is Asian Eye Institute's chief optometrist. He's also a contact lens and low vision rehabilitation specialist. He took up his Doctor of Optometry at the Manila Central University and then obtained his clinical fellowship in contact lenses and ocular prosthetics at the Contact Lens and Ocular Prosthetic Training and Research Center. He then underwent clinical fellowship in low vision rehabilitation at the Massachusetts Eye and Ear Infirmary at the Harvard Medical School. Currently, he serves as the chairman and the founding fellow of the Philippine College of Optometrists. So when it comes to anything to do with um, checking your vision, Dr. Jess would definitely know about it. So, Doc, how was your New Year? How was your New Year celebration?
Well, I think it's the same with a lot of us. We are able to, with the ease of the quarantine, somehow celebrate a little bit
Mm-mm.
with my own family.
Mm-mm. And then,
So,
interestingly enough, Doc, like you, like so many other families, they also celebrated with their own loved ones. But now that we have a surge, we're back on alert level 3, at least in Metro Manila. So in a
correct.
lot of ways, that has meant that there's a limitation in access to some clinical services, including in Asian Eye. So we've
That's
implemented
correct.
a health break from January 13th to 19th. So it's actually ending this week. So for those that would like to schedule their checkups for at least urgent and emergency care, we're still open for you. But at the same time, we're trying to prioritize the ones that need care the most.
That's
Um,
right.
so Doc, first things first, ano ba tong Ortho-K contact lenses?
Okay. Ortho-K is a rigid gas permeable contact lenses that you put on your eye if you have an error of refraction at nighttime, and you remove it when you wake up in the morning. And you can see clearly after you remove it without any eyeglasses or contact lenses. So basically, it corrects your vision temporarily.
Mm-mm. So when you say Doc temporarily, how long will my vision be corrected if I'm wearing Ortho-K?
Um, when you are already on your retainer's period, which means that the lens has already corrected your vision, and the only reason why you are using it so that you will continuously experience clear vision, it will last in 24 hours.
Okay, okay.
If your grades are lower, apparently we see patients that even after 24 hours, their vision is significantly clear. So sometimes they don't use it, but
Ah,
generally they don't use it every day. But generally, our recommendation to achieve a consistently clear vision every day is to wear it at nighttime every night.
okay. So para kang nag-charge ng cellphone. When you get
Uh,
home, you charge your phone. So para in this case, it's like you're charging your eyes.
yeah, that is a very good analogy. Basically, you put the lens to charge, and you can see
Mm-mm.
clearly.
Okay, so at least dun, Doc, we're seeing kung ano yung main difference between a regular contact lens at saka Ortho-K kasi first things first, sinusuot mo siya at night.
Correct. Now, the difference is the regular lenses, whether it is a soft lenses or a rigid gas permeable lenses, that lenses has a grade, which is the grade of your refractive error.
Mm-hmm.
So you put that on your eyes so that you can see clearly during the day. If you remove it, your vision is going to be blurred. Whereas
Okay.
OrthoK, it's not graded according to the grade of your eye, but the shape of the lens or the design of the lens is made in such a way that when you put it on your eye, it will produce a fingerprint in a way of your eye grade, correcting your exact refractive error. So when you remove it after you wear it for at nighttime rather, you can see clearly after removing it. So that's the
Okay.
big difference.
Mm-mm. Kasi the way that I think about it, Doc, siguro, the way na in-explain nyo, kapag regular contact lens ang gamit ko, it's like literally picking up kung ano yung grado of what if I were wearing glasses. Kung ano yung grado nun, yun ang ilalagay mo sa contact lens. And the effect niya, it's like as if eyeglass correction, pero in contact
Correct.
lens form. Pero kapag
Correct.
Ortho-K lenses naman ang gamit ko, parang yung shape niya mismo, ang purpose ng lens is i-compel yung eyeball mo to follow that shape para corrected siya.
That's correct. Yes.
Okay. So, ganon.
And it is a very exact method. It's digitally produced lenses, so that whatever we design to produce the necessary grade, even if you have astigmatism, uh, it can be produced by the lens design by the
Mm-mm.
Ortho-K
So,
lens.
so Doc, ito Ortho-K lenses, is it just for people na nearsighted, yung may myopia, or for other eye conditions, as you mentioned, astigmatism pwede rin?
Yeah. Yes. Primarily, it is used for myopia because there are more patients with myopia than other conditions. And usually, if you have myopia, there is an accompanying astigmatism. We rarely see patients with myopia without any amount of astigmatism. So, and also it can correct farsightedness to some degree, and by designing a particular grade, we can also correct or particular lens, we can also correct presbyopia.
Okay. So, pati yung mga older patients na siguro hindi sila sanay mag-reading glasses, they can actually come to you and say, ayoko mag-reading glasses, pwede bang contact lenses na lang na pang near vision?
Correct. It can be done. It can be achieved with proper screening. If you can be a good candidate, we can provide you ortho-K lenses.
Okay. Okay, Doc. So at least, interesting kasi it clearly, hindi lang siya para sa mga batang pasyente. Pwede rin siya for older ones. Really depending kung ano yung need mo. Basta't pasado ka sa screening.
Correct. Yeah, that's right. Yeah, most patients that I see, across different ages, because children, I also see those who are working. They don't want to wear lenses when they're working. Maybe they are doing some kind of work that wearing eyeglasses is difficult or not allowed, maybe, or contact lenses also, it's difficult to wear at daytime. So they want to have clear vision without anything on their eye or wearing something on their face, so that they can wear ortho-K lenses.
Mm-mm. So roughly, Doc, kapag nagsuot ako ng Ortho-K lenses, gaano katagal ko siya dapat suot for it to work?
Okay. Well, 6 hours. You can wear it longer. It will not overcorrect your vision. But in case that if you are already in a retainer's phase, if you don't wear it 6 hours, your vision will still be clear, because it's basically maintaining the shape of your cornea. If you are already, usually you attain that within a week, within
Ah,
1 week.
okay. So mabilis lang pala siya, Doc. Okay.
Yes. Pag medyo mataas, the grade is a little higher, at saka lang siya medyo mas tumatagal ng konti.
Okay. When you say, Doc, na kapag mas mataas, around what range of eye grade would that be?
Yeah, kapag yung grade mo nasa mga -5 na, -6, yon
Mataas na nga yun. Yun
mataas
yung,
na.
literally kapag wala siyang suot na salamin, wala talaga siya nakikita.
Tama, oo, that's right.
Okay. And then, Doc, you
Without
mentioned kasi
without
na
moving
it's a,
closer kung nearsighted yon.
oo,
Parang,
kailangan mong lapitan
yes.
talaga.
Yeah, that's the reason why some patients they want to use Ortho-K because when they wake up at nighttime, nakasuot sila ng contact lens, di ba? And their vision is
Mm-mm.
clear. Because
Oo.
Ortho-K, when you use it, pag suot mo pa lang, clear na siya eh. You don't have to wait for
Ah,
6 hours. Pag
okay.
suot mo pa lang, is already clear. So at nighttime,
Mm-mm.
your vision is clear. So
Nice, okay.
when you remove it, clear din siya. Kaya
Oo.
yun nga, when you start using it, so wala nang point in time na malabo ang paningin mo. Kasi kung
Oo.
eyeglasses or yung regular contact lens, pag inalis mo yung eyeglasses mo, malabo. Inalis mo
Yes.
yung soft or contact lens mo na pang daytime, malabo yung paningin mo. And so when they
Oo.
wake up in the evening, malabo yung vision nila and they have to look for their eyewear.
Mm-mm. And then you said kasi, Doc, na it's a rigid gas-permeable contact lens. So kapag rigid, ibig sabihin matigas siya. Gas-permeable just means na air can pass through it. So it's comfortably warm. Pero kapag matigas pa ang contact lenses, masakit siya suotin or uncomfortable?
No, because this lens is um, it's a large, it's a bigger lens than a regular rigid gas permeable lenses. So it will not move significantly on your eyes. It is very stable. And since it is actually designed to reshape your cornea, it will be stable and uh, less irritation on your eye. So if you are currently using a rigid gas permeable for daytime and you are transferring to this, you will find that these lenses are significantly more comfortable. But if you compare, of course, to
Mm.
soft lenses, when you wear soft lenses, it's comfortable because it's soft. But RGP lenses, you need a few hours or a day to adjust to it. Once you're adjusted, I always tell my patient if you have new watts, for example, and you wear it and it's your first time to wear it, you can feel the your watts, right?
Yeah.
Because it's
You can
heavy,
feel the
because
weight
it's
of
new,
it.
right?
Yeah.
Yeah.
Mm-mm.
There's no pain, but you know that you there's something there and you feel it. Pero pag matagal na, sometimes you look for it, but it's already on your wrist, right? Because
Yeah.
your brain already adapted to it. So once you are neurally adapted to the lens, then when you put it, you will not have that kind of discomfort anymore.
Okay. And then, Doc, paano naman yung mga patients, kasi you were saying that usually you have to wear it while you sleep. So, paano kung yung mga pasyente nyo na night shift? Pwede ba sa kanila yung gantong lenses?
Yes, because they sleep definitely at
Oo.
whatever time. I mean, maybe nighttime ang work, but they sleep during the day. So you sleep during the day, and then
Just
your
wear
vision
the
will be
lenses.
corrected. Yeah. So parang you're just changing the sleeping
Mm-mm.
pattern
Iba lang yung
or
oras, pero basta't
time.
suot mo
Yes,
siya ng tulog.
that's right. Correct. Yeah.
And then, Doc, what if yung pasyente naman nasuot niya ng less than 6 hours? Is that okay?
Yeah, pag nasut niya less than 6 hours, okay lang yon because the vision is still clear. In case lang na at night, kung nasa retainers period ka na, wala na, okay na yon. You wake up in the morning, you remove it, it's going to be clear. No? Pero kapag nasa correction phase na tinatawag, yung 1 week, kapag medyo mababa, bago mo achieve yung full correction, yung sa period na yon at hindi mo nasut ng 6 hours, syempre, you don't expect that your vision will be very
Fully
clear
corrected, yeah.
yeah at the following day.
Mm-mm. Similar, kapag nag-charge ka ng cellphone ng medyo short, you don't expect na fully, it's gonna be as strong or to last as long during the day kapag ginagamit mo na siya.
Yeah,
And then, Doc,
pero very
sabi mo
rare
usually,
naman na yung mga tao is sleeping less than 6 hours. I
yun
mean,
yung
not
parang
rare, but
minimum.
yeah, because you wear the lens before going to bed na eh.
Mm-mm.
Because what I advise my patient is before going to sleeping, wear it already an hour before because you might forget it and then you sleep and
Oo.
then your lens is not there.
Yes.
So you can use it an hour before.
So in short, Doc, ang general message is, tiyagain mo na yung first week of the correction phase So that even
Mhm.
if, let's say, the week after medyo makalimutan mo, hindi saktong 6 hours, at least meron ng minimum level of correction that you can enjoy.
That's right. Correct.
And then, Doc, kasi you mentioned usually yung mga pumupunta sa yung pasyente nagpapa-ortho-K are those that maybe have work na uncomfortable sa kanila magsuot ng salamin or hindi pwede.
Mhm.
What kinds of other people usually come to you to use OrthoK?
Okay. Well, I have patients who really don't want to wear eyeglasses or contact lens during the day, not related to work, but simply lifestyle. They just don't want to wear anything. So they are happy not to have any correction. So that's one type of patients that I have. Another group, yun yung mas marami, are children, mga a younger population, those that are younger than 21 years old. The reason is because in this period, this is where the nearsightedness develop quite fast, and we know that ortho-K lenses may be able can actually reduce the progression of nearsightedness. So uh, they come to me and they inquire about this lens that can also reduce the progression of their nearsightedness, uh, and that's why they have ortho-K lenses.
Okay. So, interesting yun, Doc, kasi yun nga, minsan kasi, di ba, some children, if both parents wear glasses or contact lenses, malamang-lamang, they will end up having some eye problem, nearsighted and sila typically. So, around how young can a patient try ortho-K lenses?
How young? My youngest patient, I believe, is 6 years old, five,
Mm,
6 years old. Usually, the parents are the one that really take care of their uh, kids. So, because definitely a 5 years old, if the parents are not there, will not be able to do it. But usually, they are very adaptable, and so when they come back to me, this age at this age, meaning patients that I have at this age, they come back to me and they tell me that they are the one putting their lenses already and removing.
Marunong na sila, kumbaga.
Marunong na sila. So, yeah. Yung
Okay.
initial period lang na they have to learn, they needed the support of their parents.
Mm. And siguro, Dok, malaking bagay, hindi na kasi sila worried na minsan ang parent kasi bibigyan mo ng salamin yung bata. Minsan masisira nila, mababagsak,
Mhm.
masa-scratch. So, dun
Mhm.
yung magiging source of worry pala na very active children. So,
Ah.
with OrthoK, dahil tulog lang naman sila kapag suot, tapos
Mhm.
paggising, if the parent is the one that picks them, matatanggalin yung lens, okay na sila for that
Mhm.
day.
Yeah.
Menos na lang sa pag-iisipan ni parent.
Yeah.
And then, Doc, hanggang, you mentioned kasi na when you're talking about high eye grade na kaya i-correct ng OrthoK, it can be 500 to 600. Yung 600, po ba, Doc, yun na yung maximum, more or less, na eye grade that OrthoK is able to correct?
Yeah. As a general rule, we are able to correct up to 600. There are exemptions depending on the conditions of the cornea, the shape, the thickness. So based on this information, sometimes we are able to correct higher grade than 600. But of course, if your the shape of your cornea, the thickness, the overall what we call parameters of your eye will not agree, then we will not be able to correct your grade beyond 600.
Mm. So, more or less, Doc, ang mahalaga talaga is mag-undergo ka ng screening para malaman natin kung appropriate talaga ang paggamit ng OrthoK para sa'yo.
Yes, because there are information that we need to get to check if you are a good candidate for ortho-K lenses.
Then
If
siguro,
it
Doc,
will be
malaking bagay.
successful.
Yeah. Malaking bagay din, Doc, siguro ang lifestyle.
Yeah, we put lifestyle also. We ask patient with regards to their lifestyle, why they want to wear ortho-K. Usually, my question is when my patient comes to me is, what is the purpose or reason why you want your vision to be corrected by ortho-K? And they tell me, and a lot of these is related to lifestyle. uh, although supposed to be as a doctor, our primary purpose is to manage their vision and reduce the progression of their nearsightedness. But apparently, a lot of them also is interested to have it because they don't want to wear anything and they want to be more flexible, go around, do activities without any uh, disabling vision because of eyeglasses or the regular soft contact lenses or regular contact lens that is used during the day. Because if you have certain sports, sometimes you cannot wear eyeglasses, right? So
Yes,
you
dahil ako contact sport.
Yes. So, you wear contact lens. But sometimes, if you use contact lenses, you get,
Infection.
yeah, infection, or during your game, it irritates your eyes, or the lens is actually not in a center position, something like that. So it makes your vision
Mm,
not so stable, right? Especially if you have
okay.
astigmatism. So that's the difference when you use Ortho-K, because it's like you having no refractive error temporarily. It's like you don't have error of refraction. That kind of
Okay.
that
Iba
kind
yung
of
tingnan, Doc. Oo.
experience.
Yeah. It's like you're simulating really what it would be like kung wala kang problema sa mata. Kung wala kang
Tama,
nearsightedness, wala kang astigmatism, you're able to simulate it and do it in real life.
tama,
So, it gives them a taste of what it's like for everyone else who does not
tama.
have an eye problem. Ito
That's
naman,
right.
Doc, kasi you mentioned kapag nagko-contact lens, minsan may irritation, minsan hindi naka-center yung lens sa mata, kaya hindi ganun
Mm,
ka-stable yung vision. Pero
mm.
what if may mga tao rin na medyo madalas nagkaka-sty, other eye infections, namumula yung mata, would they be qualified to do ortho-K lenses?
The first thing, if they have this condition, is to manage that condition, because of course that is disturbing in the process, because you develop sty often. But it's not a disqualification if you don't have it. If you have it during the time of examination, of course our goal is to manage that. But if none, then we just have to provide patients with proper care, how to handle the lenses, how to maintain it, disinfect, um, so that they will not aggravate existing conditions.
Okay. How about people, Doc, na merong mas serious condition? Let's say they're a patient na may keratoconus. Pwede ba yun? Is it also an option for them?
Okay. One of the condition that is disqualified for wearing Ortho-K is keratoconus. So we are not correcting patients with keratoconus using Ortho-K, because there's another lens which is a keratoconic lenses that we use. So unfortunately, that lens is a lens that you need to wear during the daytime wear.
Okay. Oo. So magkaiba lang talaga. So it is a different kind of lens,
Yeah.
specifically kapag meron kang keratoconus.
Yes.
And then, Doc, madalas kasi natin naririnig na may mga tao na may lazy eye na nagpapalasik or gusto na lang magpalasik. Would it be similar? Kunyari may lazy eye ako, pwede ko bang subukan ang Ortho-K?
Okay. Of course, Ortho-K cannot correct the lazy eye,
Mhm.
but it can correct the refractive error. So if you have a lazy eye and you have refractive error and you're using your eyeglasses and you can see clearly, but not that clear like normal because of the lazy eye, we can achieve that using Ortho-K lenses. So, but
Mm,
we are not expecting anything better. I mean, clear vision better than um, eyeglasses. However, if you are a patient that has an equal grade and that's the cause of your lazy eye, and it's difficult for you to wear eyeglasses in that sense, because people with an equal grade, usually they cannot wear eyeglasses. They have to use contact lens. Then
mhm.
Ortho-K can be a good option.
Okay, so
But
at least, yeah,
yeah,
at least it's an option, Doc. It really just depends on what kind of lazy eye they have. So it's still a matter of assessment. Kailangan
Correct.
makita ka ng doctor mo. Hindi mo basta-basta sabihin, hindi, doc, gusto ko mag-ortho-K. We
Yeah.
actually have to assess your eyes first.
Yeah. As long as it's clear to them na it is not used to, because iba yung pag-manage noong lazy eye. One of the is to manage the refractive error. So that's what OrthoK can manage. But other management for lazy eye
Oo.
should continue, right? Or should be
So
done.
kailangan, I guess, the doctor who's treating your lazy eye has to know na meron ka interest in something like ortho and vice versa. Just so that your doctors can discuss, they can work together to give you a solution na
Mhm.
appropriate para sa condition nyo.
Yeah.
Doc, you mentioned na para dun sa mga bata na minsan, di ba, bata pa lang, medyo mataas na yung grado nila, and they've used ortho-K lenses para mabawasan yung gaano kabilis tumataas ang nearsightedness.
Hmm.
Paano ba ito nag-work? Like, ano yung meron sa ortho-K lenses that allows that to happen?
Okay, very good question. The reason why the people develop nearsightedness, the primary reason is the eye grows faster than normal,
Mm-mm.
and sometimes it continues to grow even if supposed to be at that time a period of time it should not be growing. So and based on a lot of studies, the reason why it's growing, one reason for that is other than familial or the history, family history of nearsightedness, is the condition where people are indoor, not going out. They are just using gadgets
Oo.
all the
Lalo na
time
ngayon, Doc.
inside. So and we see patients really developing nearsightedness. So, anong ginagawa ng OrthoK? When you wear OrthoK corrects an area of your vision, but not the whole that the whole area of the cornea. So, basically, based on study, even eyeglasses, that is an approach we call peripheral correction of myopia. I mean, not correcting the peripheral myopia. We are basically correcting the center. So, based on study, that reduces the increase in nearsightedness by 50%. So
Wow,
can you,
okay.
yeah, can you imagine if the progressive myopia increased by 75 to 1.75 to 1.0, uh, diopter, or in layman's term, 75 to 100
Oo.
grade, every year. So if your child is 10 years old and he has, for example, a minus 2.0 or 200, and the nearsightedness is increasing by 100 per year,
Mm-mm.
in the next 5 years, that probably
Ang
will become
taas. Yeah.
minus 700 or
Yeah.
7.0.
Oo.
So,
It would
but
be
if you,
very uncomfortable, Doc, no? Uncomfortable yun
correct.
eh as you're growing up.
Yes, but if you use Ortho-K, so it will reduce the progression. If it is by 50%, then it will not be 7.0, but it will be like 4.50. So I'm just giving you idea how it's working. So
Mm.
at least the grade is not so high. It
Oo.
may still increase, but it's not so high. And eventually, when you reach a certain age, like 21, and your grade are stable, stabilized na, then you can still be a candidate for procedure like LASIK. Because, of
Okay.
course, if your grade significantly increase, there are two things that could happen. One is you may not be a good candidate for a certain refractive surgery. And two
Oo.
is the retina of your eye will become so thin that you may develop what we call myopic or nearsightedness retina or retinal degeneration, which can
Oh, okay.
reduce your vision and can put you at risk of developing uh, retinal detachment in older age. So that's what we are trying to, of course, prevent or manage
Okay.
using ortho-K lenses.
Okay, that's interesting, Doc, kasi yun nga eh. Minsan naman, um, hindi you want to consider LASIK down the line. Yung alam mo
Mm.
naman lalo na siguro kung parent ka and you have a child and you know that they're already wearing glasses, you
Yeah.
just want to give them a fighting chance na by
Yes.
the time they turn 21, at least option sa kanila yon.
Correct.
Hindi siya yung hindrance na I'm really sorry, we have nothing that we can do. It's just, a high eye grade. At least now with Ortho-K, we have an option to, okay, let's wait it out. Let's see how you're doing at 18. Let's see how you're doing at 21. Dahil
Mm.
napigilan mo na yung mabilis na pagtaas ng grado, makikita ng doctor mo, your basic doctor, okay, mukhang pwede to. Mukhang your cornea is thick enough. Yung retina
Mm.
mo is healthy enough.
Mm.
Nakakayanin ng mata mo. Magpa-LASIK. So what
Tama.
we're doing with Ortho-K is not completely solving what the issue is. It's giving
Yes.
you a chance to get it solved at the appropriate time.
That's right. Correct.
Doc, ito naman, ang madalas ko napapansin na issue kapag, ngayon, lalo na pandemic, is at maraming tao nagko-complain ng dry eyes. So
Mhm.
kapag dry eyes ka ba, pwede kang mag-Ortho-K? Kasi kung ginagamit mo siya ng tulog, would that be an issue?
Okay. Uh, well, there are generally we do not put lenses to patients with severe dry eyes. But there are different types of dry eyes. It could be mild, it could be moderate, or it could be a severe types of dry eyes.
Mm-hmm.
Um, Now, of course, when you wear lenses and your condition is, if you are normal, you can also have dry eye related to the contact lens because when you wear it, you're supposed to maintain it with a lubricating eye drops.
Yeah.
So, if you have dry eyes, if it is not a severe types of dry eyes, you can still wear contact lenses and you can put or manage your dry eye using lubricants if it can
Okay.
be managed by lubricants. So, it is not a disqualify. You will not be disqualified because of dry
Dry
eye.
eye lang.
Yeah, but there is a certain types of dry eye that you may be disqualified.
Okay. So again, Doc, mahalagang ipa-check mo sa doctor mo. Kapag
Yes,
sinabi mo na sa doctor, I'm interested in Ortho-K, the doctor will definitely check kung ano na ba yung degree ng dry eye mo.
that's
And
right.
lalo siguro kapag contact lens wearer ka, you have to at least get a yearly checkup para malaman. Baka naman sa kaka-contact lens mo, hindi mo nalalagay yung lubricating eye drops. Baka you are developing like a more severe version of the dry eyes.
Yes.
Okay. And then, Doc, you mentioned that syempre there are so many of these factors that you have to consider before makapag-prescribe ka ng Ortho-K.
Mhm.
Um, ano ba yung mga different tests sa screening na ginagawa?
Okay. One is we test, of course, a standard the grade of your eyes. We look at as a standard test the condition of your eyes. If it is healthy, if there's any problem, we also look at that. But on top of the what we call comprehensive eye examination, we do additional tests. One of these is we measure the shape of your cornea, the thickness of your cornea, the size of your cornea, meaning how big is the cornea. Um, and also, we measure uh, 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 the grade of your eye with a psychopledic refraction, we call it, meaning we put eye drops to make sure that we get the real grade because sometimes due to tired eyes or spasm of the eye, you can have higher an amount of nearsightedness. These are the tests that we use to determine if you are a good candidate for Ortho-K. And these tests also are the ones giving us information to design a an Ortho-K lenses for you. Because, of
Mm-hmm.
course, we will base it on the actual shape, thickness, size of your eye.
Mm-hmm.
The design is based on that.
Okay. And then, Doc, matagal ba yung process na to? Will I have to stay in the clinic for so long?
Well, if you talk about the test, it will take about an hour. But of course, sometimes there are other people also falling in line because you transfer from one test to another. So then that's the time. That's the one that Sometimes
Takes
you
about,
can, yeah, it takes about 1.5 to 2 hours. But
okay. So at least,
if there
yeah.
is no, there's no significant queuing doon sa mga test na yon, 1 hour is enough.
Okay. And then, Doc, kasi we were discussing na kapag bata ka and you do Ortho-K, eventually you could actually get LASIK done when you are 21 years old or older. But let's say you're an adult and ang pinagpipilian mo, mag-Ortho-K ba ako o magde-LASIK? Ano ba yung different, I mean, the significant differences between those two?
Screening, you mean, or
In terms of the benefit. Kasi,
okay.
um, yeah.
Well, there are patients that do not that are not a good candidate for LASIK, but they can be a good candidate for Ortho-K lenses. So I have patients like that. Um, so the difference is in Ortho-K, it is not a permanent correction. You only experience clear vision as if normal. You don't have any refractive error when you wear your lenses at night time. Of course, we know LASIK, when you have it, it's a permanent correction. Uh, so that's one. And if you're adult, we can passion your Ortho-K lenses also if you are 40 years old and above, so that you don't have to use reading glasses. Because when you
Mm-mm,
are 40 years old, adult, you will wear reading glasses. So
mm-mm,
you wear Ortho-K at night time and then you
mm-mm.
remove it during the day. It's clear, but unfortunately, you have other problem which is reading. So now
Oo.
you have to use reading glasses. So I tell my patient it doesn't make sense. I supposed to give you Ortho-K so that you don't wear any glasses or contact lens during the day. But in this case, you have to wear reading glasses. So we design an Ortho-K lenses so that you don't have to use reading glasses because you can also.
Mm,
So probably these are the difference between the Ortho-K because of some flexibility.
mhm.
But with some, if these are communicated earlier, the LASIK earlier, it can be designed. If you're old, also it can be designed as well, and you
Okay,
don't have to use reading glasses after LASIK. But that has to be
discuss. You have to tell
discussed.
your doctor na yun ang
Yes,
focus mo.
that's right.
Okay. And then, Doc, since ang suot mo naman yung Ortho-K during the night, ang concern natin usually kapag nagko-contact lenses at let's say during the day kapag daily wearer ka, is that
Mhm.
kapag kinakamot mo yung mata mo, it just so happens you might have that habit. You are prone to infection.
Okay.
Kapag Ortho-K ba, are you also prone to infection or less so?
Okay. Of course, if you wear contact lenses, there are risks, and we discussed that to patient. Of course, one of this is allergy. You can get allergy related to the solution or related to the a lens when it accumulates what we call protein deposits. That's why we use a
Mm,
cleaning solution to remove the
ah,
protein so that you don't develop any itchiness on your eyes. And of course, you can also develop infection, whether it is Ortho-K or regular lenses, because of course nobody touches their eyes every day, right? You put your lens, you remove it. If you don't wear contact lenses, so of course we advise our patients that they have to wash their hands and they have to soak the lens in a disinfecting solution to, of course, remove any microbes that can affect their eyes and avoid infections. The difference, though, is when you are wearing regular lenses during the day, of course, you wear your lenses longer because you're awake for how many hours, right?
mm-mm,
Uh, so as compared to wearing Ortho-K for 6 hours or during
ah,
your wearing time. So I mean, it's sleeping time. So the wearing time is very short. That's one. So number two is when you are sleeping, the oxygen coming from air is already cut anyway. So when you are sleeping, talagang nawawala, nababawasan yung oxygen supply sa mata, right? Oxygen supply is important for our eyes. Now, but the difference with the regular lenses is when you wear the regular lenses, it reduces the oxygen supply when you wait during the day. But of course, we talk about high oxygen transmission lenses. Sometimes you hear that in soft lenses. But in Ortho-K, you don't have to worry with that with that problem because you are not wearing your lenses during the day. So the oxygen supply at daytime is normal, like what the normal individuals not wearing contact lenses can
Mm-mm.
experience.
Okay. And then, Doc, kasi, for example, a lot of people, the ones that are able to travel, pwede bang suotin, let's say, in flight, ang Ortho-K contact lenses? Kasi may mga nagsasabi na at a certain above sea level range, hindi na pwede yung contact lenses. Is that true? Is there anything that would happen to your lenses kapag suot mo siya in flight?
Yeah, the good thing is you most likely don't need to wear contact lenses when you are in flight because your vision is clear and sometimes can last for 24 hours. And you know, our flights, usually our flights naman, wala naman tumatagal ng,
Oo.
uh,
Usually,
ng
mag-disembark ka. Tapos,
it's less than 24 hours, right? Not unless na stranded ka, you get stranded and you have to stay. But usually you will also sleep when you go out and then stay in a hotel and then probably you can wait. So for me, it's very convenient if you are going to go and take your flight. You don't have to wear your lenses and your vision is still clear.
okay. And then, Doc, so let's say I'm a user of Ortho-K contact lenses. Iba ba yung ginagamit mong solution kapag Ortho-K lenses versus regular contact lens?
Okay. Kung soft lenses, between soft and hard lenses, talagang magkaiba yung solution yan, yung rigid and soft. Okay, so now, with regards to the rigid compared to a rigid na Ortho-K, the solutions are the same, except that there's an additional solution to remove the protein deposit because we really don't want the protein deposit to be there for two reasons. One, is to avoid allergy. Two is to provide you the maximum correction needed. Because kapag
Mm,
mayroong film of protein doon sa lenses, of course, it can affect also the correction of your grade. So that is why we needed a extra cleaning solution for
okay.
Ortho-K lenses.
And then, Doc, kapag user ka of Ortho-K lenses, is it similar to people that wear eyeglasses or contact lenses na every year posibleng mag-change? Or how long does a pair of contact lenses last?
Okay, that's a good question. It depends on materials that we use. Some materials can last longer, others will can last shorter. But generally, we use a material that can last longer because, of course, we want you to not worry on keep on replacing your lenses. Others may advise to replace it once a year. But in my experience, we basically look at the conditions of the eye, how much grade is being corrected. We look at the quality of the lens, and there are patients that last even 3 years. So, but there are patients who basically rub their lenses differently, probably, or they rub it too much.
Mm-mm.
They put a lot of scratches on the lenses. That is when the lenses might be replaced in 2 years' time. Uh,
Okay.
but it can last up to 3 years
Mm-mm.
if you take care of it properly. And of course, if your grade is not increasing significantly, we don't have to
Ah,
change because your lens probably is very good. There's no problem, but the eye has changed. The grade has changed. So uh, we need to change the lens as well in that
okay.
case.
Oo nga, Doc. So, as with all things, nasa pag-aalaga rin talaga ng gamit mo, right? It's something that you're using every night. You have to be careful also about the way you use them and also the way that you clean them. And at least, ituturo naman sa'yo yun eh. Like when you get your
Yes,
lenses, the doctor will in fact show you how it's done.
that's right.
Um, in this case, I'm sure there are some people that watch us from different parts of the country. Pwede ba silang basta-basta mag-order ng Ortho-K para ma-ship sa kanilang probinsya, sa kanilang other cities?
Okay. If this is their first time to wear
Yes,
Ortho-K,
Doc. Kapag
yeah.
first time.
If this is your first time to wear Ortho-K lenses, we cannot do that because it requires we will not be able to design the lenses
Mhm.
because there are parameters that we need to get uh, from your eye. So we need to measure those parameters so that we can design appropriate lenses for you.
Okay. So yon again, kailangan nyo magpa-check up para makapag-screen si doctor sa condition ng mata mo at siya ma-design niya specifically para sa mata mo kung ano yung appropriate design ng OrthoK lenses. Kasi nakadepende yan sa kung ano yung grado ng iyong mata, ano yung needs ng iyong vision para ma-correct siya appropriately. So,
That's
for
right.
those that might be wondering, so yung OrthoK package from Asian Eye, it costs about 45,000 pesos. It already includes the screening, a pair of the contact lenses, as well as yung trial and fitting session with Dr. Caguioa, as well as follow-up consultations up to 6 months post-fitting. So for those that are a little bit curious, you want to know kung appropriate ba ang OrthoK for you, that's a good time to get screened. So at least you have an idea of more or less how much it costs and what's included in their package. We also have a number of questions, Doc, from our viewers
Yeah.
today. So the first one is, I have dry eye due to contact lenses, and my eye prescription is minus 475 on the right, axis 180, and then um, minus 575 on the left with axis 10. Am I an ideal candidate for OrthoK?
Okay. I'm not sure if the minus 475 axis 180, that means you have an astigmatism of minus 475 and minus 575. Or there's a missing figure there that would
Kulang
say
ng isang item.
475, yes,
Oo.
combined with, and then the power of your astigmatism, and then axis 180. Okay. So as written, it appears to be like astigmatism of 475 and astigmatism 575. You will not be you will not qualify. Very rare. If you have this kind of astigmatism, you need to undergo a screening for keratoconus, especially if it's
Okay, okay.
progressive type, right? Now, kung
Oo.
in case lang na mali or there is a problem with writing and may missing and it says that it is a minus 475 nearsightedness and a minus 575 nearsightedness on the other eye. And it means that you can qualify, but you have dry eye. Tama ba? It means that we need to manage dry eye first and see how it will respond to dry eye management. And if it improves and it becomes stable, and we think that you can already start wearing OrthoK, then we can provide you OrthoK lenses. Uh,
Okay. So I think two factors dito is at first, you have to make sure kung ano ba talaga yung eye grade nitong patient na to, Doc. So it's really a good idea for this patient to come and schedule an appointment para we'll know. Kasi
mhm.
ito po yung basis natin kung pwede ka talaga magpa-ortho-K lenses or as doctor said, depending on what that eye grade is, you might actually need to get screened for something called keratoconus. So siguro,
Mhm.
Doc, just a quick primer for people that are watching today. Ano ba tong keratoconus? Why do we need to screen for it?
Okay, keratoconus usually it starts with unstable astigmatism. Usually, astigmatisms are stable, but when it starts to become unstable, you see that it's increasing. Then it is an indication, one indication that there is a irregularity that's happening in your cornea. And so we cannot measure that using a standard procedure that we use to get the grade. So we use a special instrument that measures the thickness, the shape of the cornea, and we call it the corneal topography. And from there, we'll be able to determine if there is a probability or there is already a sign that you have a keratoconus. Because we also see in that test probability that you will develop keratoconus, or we already know that you have, but it's still mild. And so we advise you on what you need to do in order to prevent it from progressing. And if it is significant and you need some treatment, then we can advise you to consider certain treatment for keratoconus as well. And plus
Okay.
the fact that we can correct your vision using a rigid gas permeable, but not OrthoK, using keratoconic lenses.
Okay. So the good thing here, Doc, is that if you know what the condition is, what the true condition of your eyes is, meron tayong options. Hindi yung you just have an idea but you're not sure, you don't know what your next step is. In this case, we can in fact parang take you through
Mhm.
what your condition is, ano yung possible progression niya, at ano yung pwede natin gawin about it.
Yeah.
And then, Doc, we have another question. It's from Anna Marie naman. Pwede po ba ang Ortho-K lenses sa strabismus?
Okay. It depends. If the type of strabismus is a strabismus that you should not be wearing your eyeglasses when you are looking at near. May mga ganun eh. And you have to
Mm-mm.
wear sometimes bifocal eyeglasses to be able to manage your strabismus. Then you will not be a good candidate for Ortho-K.
Mm-mm.
But if your strabismus can be managed by a doctor that specializes in strabismus, then that should be managed first. If there are strabismus that uh, 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 they are being observed and it will not affect their vision or the strabismus if they wear the glasses also at near, far and near, and they want to have another option instead of wearing eyeglasses, then they can be a candidate for Ortho-K lenses.
Okay.
Without, of course, Ortho-K cannot correct your strabismus. There is a management that is used to manage your strabismus. So if you have that, my first recommendation is go and see a doctor that specializes on strabismus and manage that first. And if it's managed, then we can probably consider your Ortho-K lenses.
Mm-mm. So, depende. Kailangan talaga natin. As with any condition, you have to manage it first before we can do any other steps afterwards. And then, Doc, kasi kanina pinag-usapan natin yung lazy eye. Ano ba yung kaibahan ng lazy eye sa strabismus?
Lazy eye is a condition that may be accompanied by strabismus, but sometimes no. There is no strabismus, but they have lazy eye. So it depends with the cause. The difference is if you can have strabismus and you can see when you cover one eye, it's still 20/20, and then the other eye still your vision is 20/20. But lazy eye, your eyes may be both eyes are straight. You already wear eyeglasses or contact lenses to correct your vision. Now, when you cover one eye, it's not 20/20, and you cover the other eye, it could be 20/20 on the other eye, right? Or sometimes, even if it's corrected, both eyes, the vision is still blurred, both eyes, and there is no other problem. Walang sakit sa mata. Healthy yung mata mo, except na unequal yung grade mo significantly, or meron kang strabismus. Other
Okay.
than that, wala kang ibang problema sa mata. Then that maybe that can be considered as a lazy eye.
Okay, so depende talaga, no, Doc? Kasi you were saying lazy eye can be due to mataas yung grado ng isang mata. Kaya
Yeah.
nagle-lazy eye yung kabila. So that's
Oo.
one. And strabismus, yung hindi lang siya dumidiretso. So
Oo.
yon, pwede kasing treatable yon, pero magti-20/20 ka pa rin. So depende talaga, you
Yes.
have to see your doctor, alamin natin ano pa talaga yung cause nitong blurring of vision mo or yung hindi pagiging diretso ng mata mo. So, if you want to consider Ortho-K, unahin muna natin yon. Check up muna, alamin natin yung condition, saka natin isipin or tingnan kung qualified ka para mag-Ortho-K lenses.
Mm.
And then this one naman, Doc, there's another question is, uh, ano ang maintenance para sa lens? For me na candidate for corneal transplant, hindi ba ito advisable?
If you are a candidate for corneal transplant, ibig sabihin, meron kang ibang problema sa mata that will require corneal transplant. And in that case, you will be disqualified from wearing Ortho-K lenses. Um, yeah.
So, kumbaga, if it's quite a serious condition, like something that requires a transplant, unahin mo na yon. Tapusin muna natin
Yes.
yon. Kasi you would want to
Yes.
know how that eye is doing after the transplant is done.
Yes. And usually, Audrey, after the corneal transplant, there are patients that will need contact lenses to correct their vision because it is best corrected by using contact lenses. Um, uh, but that will not be Ortho-K lenses,
It's a
because
different
we
kind of
do
lens, though.
yeah, because we do not use Ortho-K lenses for people with corneal transplant.
Okay. And then, Doc, kasi kanina we talked about how kapag nag-ortho-K lenses ka when you're young, it can give you a chance to get LASIK done. How about PRK? Pwede ba ako magpa-PRK pagkatapos ko nakapag-ortho-K lenses?
Yeah, you just have to discontinue your Ortho-K lenses, and you will be able to recover the shape of your cornea prior to putting Ortho-K. Then after that, you can have your eyes evaluated for refractive surgery, whether that is a PRK or LASIK. And if you are a good candidate, you can go and have your surgery. So you need to
Okay.
consult in that case the specialist for refractive surgery. Just discontinue your contact lenses for
Kasi uh, I remember, Doc, you said the interesting part of Ortho-K is that kapag tinigil mo yung paggamit nito, babalik naman yung shape sa dati niyang shape ng mata.
yes, yeah,
So doon natin magiging basis ng assessment of your LASIK doctor to see kung pang LASIK ka ba or kung pang PRK.
yes.
Okay. And then, kapag mataas ang astigmatism, like -350, pwede ba ang Ortho-K lenses?
Okay, yung 350 challenging na yon to put Ortho-K. Although there are Ortho-K that we call it the toric Ortho-K design. But that
Mm,
will be challenging already to correct. I have to
okay.
look at the other findings. Generally, ideally, if the astigmatism is at -150, we know that, wow, it's okay. It can be ideal for an Ortho-K fitting pa rin. But if it is 350, sandali muna, there are
Ah,
challenges
check
that
muna
we will
natin.
encounter in
Oo.
making a design.
Okay. And then ito, Doc, this is an interesting question. From Catalina, I have hyperthyroidism with high astigmatism. I'd like to know if this can be an option for me.
Of course, na-mention yung hyperthyroidism, that's different from the refractive errors, of course. That's a different problem. You probably need to see your doctor and manage that. It might have some effect on the eye, but definitely not due to a high grade. So if you have a high grade, how high is that? Because if your grade is -10, I don't think you will be a candidate for Ortho-K lenses. But if your grade or nearsightedness, for example, is six diopters and below, or 600, you may qualify for Ortho-K.
Okay. And then another question.
Or
Okay.
high astigmatism ata yung tanong niya, no? High
Yes,
astigmatism
Doc,
pa rin, no?
astigmatism. Yung
Yeah,
prescription ng patient na to, Doc, is -650. Um, I think -250 by 180
yeah,
OS. Yeah, yeah.
mataas na
For the
nga
whole,
yan.
mataas,
So,
mataas na siya, Doc, na.
yeah, mataas na yan. That will be a bit challenging already to correct. It can be unstable depending on the corneal shape, because it depends where it's coming from, the astigmatism coming from. Uh,
Okay.
yeah,
Kasi again, Doc, siguro combination siya of checking with your thyroid doctor and at the
mm,
same time correlating it kung may kinalaman ba siya sa eye grade talaga or it's
yes,
really having to do with an eye grade that you already have.
yeah.
Ay, Doc, I think those are the questions that we have from our Facebook Live viewers. If other people have other questions, you are welcome to add them in the comment section below. We'll try to answer them. But in general, for you, Doc, do you have any tips for our viewers today when it comes to caring for their eyes or for those patients that might be interested in having Ortho-K lenses for themselves?
Okay. For our patients, I think just for the benefit of our listener, I know that we are asking you, or we ask you to join this social media platform, and at the same time, we are advocating to minimize your near activities, because that can put a lot of stress on your eye as well. uh, of course, you need to relax your eyes after using and or watching here by going outside, look at the window, look at far. That's one way of relaxing the eyes. But
Oo.
if you, yes, um, okay. But if you are interested to use Ortho-K lenses, our advice is to have your eyes checked, undergo screening, if you pass the screening, that's the time that you can be advised of wearing Ortho-K lenses. That's the
Okay.
best way because you might be thinking of having it and then it's already na build up na. Sometimes kasi Audrey, I have kids na build up na that they will be using Ortho-K lenses and they like the idea, and so they
Mm-hmm.
are hoping a lot, and then they come to me and they are not qualified to use Ortho-K lenses, and of course
Mm.
it's kind of uncomfortable feeling. I believe I can see it on their faces that they are not
Yeah,
qualified.
oo. Because they
Uh,
wish that they could. Yeah.
yeah, because they are already hoping that they can have it. But
Mm-hmm.
so the best thing to do is to have your eyes screened. Your eyes can also be checked for other conditions other than the one related to Ortho-K when you have your eyes checked.
Okay. And then, Doc, siguro related to that, meron tayong pahabol na question. If aniridia patient, can aniridia patients be candidate for Ortho-K? No surgery has been done yet, 600 grade at saka 100 astigmatism.
Okay. Well, it can be corrected, but usually, if you have aneurysm, we use a different contact lenses to manage also the aneurysm. But that is not Ortho-K lenses. But if you're talking
Okay.
about correcting the grade, the Ortho-K, yes, it can correct. But how about the issue related to aneurysm? Are you going to wear sunglasses after you have your Ortho-K lenses? Because it's difficult to go out. There will be a lot of glare when you have aneurysm. But
Okay.
it can be reduced by using a particular lens design that can reduce the entry of light, and you will not suffer significantly as compared to without that type of lenses that can help reduce entry of light and reduce astigmat. Glare.
Okay. And then, Doc, so let's say we have a couple of viewers here today that want to schedule an appointment with you. Where can they find you?
My clinic is in
Mm-hmm.
Asian Eye Institute in Rockwell, and also I hold my clinic in uh, Asian Eye Institute in Trinoma.
Okay. So just set an appointment by calling 898 2020, or you can email us at ihelp@asianinstitute.com, or you can send us a message on our social media accounts and we can help you set your appointment. So again, thank you so much, Doc, for spending your afternoon with us. We learned a lot about Ortho-K. I'm sure may mga viewers tayo na first time nila maririnig at tungkol sa Ortho-K at malalaman nila na hindi na siya pwede sa bata, pwede rin sa mga matatanda. Depende na lang sa results sa screening natin. So,
Yes.
thank you so much, Doc, for joining
Thank you
us
so much,
today.
also Audrey, and thank you everyone for staying here and watching. Stay safe. We still
Mhm.
have situation, so
Yeah.
stay safe to all our televiewer.
Okay.
Have
Thank you
a
so much,
good
Doc.
afternoon.
Have a great afternoon, Doc. Thank you.
Okay.
So, now that we have a lot of COVID-19 cases again, a lot of our cases are increasing in Metro Manila, you can still get eye care, eyewear products, as well as eye medicines from the comfort of your home. So, this is a good thing kasi with Asian Eye Tele, you can talk to your Asian eye doctor, including Dr. Jessica Giwa, via a video call. You can avail of this service from Mondays to Sundays, and also visit AsianEyeShop.com to avail of the Asian Eye EGC, so you can get your teleconsult if you just want to try it out. You want to see if it's the right method for you to talk to your doctor. You can get it for as low as 400 pesos. And then for those that need to shop for eye care and eyewear products as well as their eye medicines, you can shop at AsianEyeShop.com, and we are offering a couple of promotions. So the first is that you can get a free upgrade to Screen Shield lenses that offers you UV plus blue light protection for daily specs and kids specs frames. You also have buy one take one on active spec sunglasses. So if you're planning to go on vacation, it's a good time to get a pair that will keep you protected and make you look good while you're at the beach. And lastly, of course, you have free shipping for purchases of over 1,700 pesos. That's nationwide. Thank you again, everyone, for joining us today. I think it's a pretty good start for our 2022. We know that there are a lot of you are staying in, you're trying to stay protected. Continue to do so, and we hope that you're able to keep your loved ones close and stay safe while the COVID variants are still out there. We're always going to be here for you when you need us. So just send us a message if you have questions. And we'll see you again at our next FB Live.